On this episode of 26 Minutes with Dr. Warren Seigel, I'm joined today by Dr. Apostol. We will discuss important women's health issues. We'll cover key topics that every woman should know in order to take charge of their health and well-being. Please join me in welcoming Dr. Apostol to the show. So glad that you could make it today. Thank you so much for joining us.
Thank you for having me.
So tell me a little bit about yourself. Where you're from, what do you do?
Sure. So I'm originally from Romania, and I moved to the U.S. as a teenager with the rest of my family. And I went to college in New Jersey, a medical school in New York, did my residency in Brooklyn, and after residency, I decided to go in private practice in Connecticut. And after approximately 4 years, I decided to go back to fellowship and do a minimally invasive fellowship in gynecology.
So you trained as an obstetrician gynecologist, am I right?
That's correct.
That's your specialty?
I'm a board-certified obstetrician gynecologist.
But then decided, after private practice for a number of years, decided to do a fellowship in what? I'm sorry?
Right, in minimally invasive gynecologic surgery.
So what does that mean?
So, well,
Sounds
to keep
important,
it,
but what
yes,
does it mean?
it's very important. Nowadays, not just me, but patients, first and foremost, physicians, they prefer to perform surgical procedure in a minimally invasive fashion. The reason being is minimally invasive means smaller incisions that were traditionally performed through a large incision. So based on years and years of research, we know now that minimally invasive surgery outperforms traditional surgical procedures via a large incision in the blood loss, in the incidence of infection, the length of hospital stay, how soon the patient can return to work, so on and so forth. So the bottom line is it's a more it's patient-centered surgical care.
So you're a specialist in women's health issues, basically, right?
Correct.
And assuming a woman doesn't need surgery, would they continue to see you, or what would you be doing as you're seeing them to keep them healthy?
Absolutely. So first and foremost, at the end of the day, I'm an obstetrician gynecologist, as I mentioned before. I do see patients in the office practice for regular checkups, for annual health maintenance, and whoever needs any type of surgical treatment, those are patients that I take care of.
So obstetrician is the person who delivers the baby. The gynecologist is the person who does women's health issues, and you do both, or you just do one or the other?
So I do both. However, I'm more focused on the gynecology point, on the gynecology portion of it. But yes, I do both.
So what are the most important reproductive health issues that you see in your practice? What are the things that women need to know in order to stay healthy?
So we see a very broad range of medical issues that affects women's health, anywhere from infertility to menstrual irregularities to pelvic organ prolapse, to infections, to postmenopausal problems such as vaginal atrophy or any symptoms associated with menopause.
So you use terms like prolapse. What does that mean?
So prolapse is something that, if you may, it's similar to having a hernia of the vaginal or pelvic organs.
So those organs start coming out?
Correct. So
Wow.
There's a weakness for whatever reason, whether it's because of childbirth or it's because of other reasons, chronic diseases or other issues. it is essentially a weakness in the tissue underlying the vaginal or the pelvic organs that that allows the organs to prolapse or to essentially herniate and come out.
So assuming that a woman has no complaints, what should she be coming to see you just to stay healthy?
We highly encourage that. We do recommend that all women come for a gynecological yearly checkup. And the reason for that is it's not just for pap smears. When patients think of gynecologists, they just think that, well, they just come to the gynecologist for a pap smear. That's not entirely correct. Pap smears are just part of the annual physical examination.
And the pap smear is done to detect cancer, right?
The pap smear is done to screen for or to catch any abnormal areas of the cervix that can potentially turn into cervical cancer down the line.
So you do that every year?
Absolutely.
What else do you do? Well, what else would a woman need? What should a woman expect if she's going to see her gynecologist? Again, from a healthy standpoint.
From a healthy standpoint.
If she's doing okay, no complaints, what should she be doing every year?
Well, if you may, let's think of it from a head-to-toe type of situation. And just to, as a side note, obstetrician gynecologists are also considered primary care physicians, meaning that we do see women for health maintenance, which involves, again, the whole entire person. And we're screening for things like breast cancer. We're making sure that the patient is also screened for cervical cancer. We also make sure that the patient gets screened for colorectal cancer and also for something such as osteoporosis. So those are things that we perform screening for all women that come for their annual health maintenance. On top of that, depending on the age, we also encourage patients and recommend different types of vaccinations. For example, the HPV vaccine, which I know that as a pediatrician you are well aware of the importance of HPV. Not only is it given in young women, however, nowadays we can actually give it up to age 45.
And just to remind people, HPV is the vaccine against cancer, correct?
Correct, cervical cancer. So HPV is actually a vaccine that, HPV stands for human papillomavirus. It is a vaccine that it's administered typically between the ages of 9 and nowadays up to age 45. It is, again, it's given for cervical cancer as a vaccine against cervical cancer. However, we know that it can also help with other pathologies, such as genital warts.
So, if I'm a woman, at what age should I start seeing a gynecologist?
That's a very good question. We typically recommend patients around the age of 15 or so to come into the gynecologist and just to establish care. They don't necessarily have to be examined by the obstetrician gynecologist, but again, just to establish care. From then, they can come on an annual basis, and as they age, we can incorporate different screening modalities and also recommendations.
So you're talking about not just doing a pelvic exam, not just an internal exam. You mentioned breast cancer screening. You mentioned the HPV vaccine. What are the other things that need to be done as part of preventive care for women?
For example, something in patients who are sexually active, we do recommend screening for sexually transmitted infections. That's something that can be done on a routine basis, and we definitely encourage women undergoing that.
And then, is there a point where you should stop seeing your gynecologist? Is there a point where you're just too old?
I would say no. As I said, and the reason for that is we see women from as young as teenagers to all the way in their menopause years. So it's a very wide range as far as the age is concerned. So to answer your question, no, because at different age groups, there are different issues or medical problems that arise. Women in their 40s or 50s, they're at risk for cardiac disease, cardiovascular disease. Women after the age of 65, they're at risk of osteoporosis, which is when the bones become thin or brittle, and if patients are not treated appropriately, they can develop fractures, and that can be very detrimental to them. So again, we do see women different ages, and at each stage in their life, we act as their primary care physician.
You mentioned infertility. If women are having difficulty getting pregnant, is that something you're saying she should be referred to a gynecologist for, or is that something she can make an appointment on her own?
No, so that's something that I think has to be discussed with the gynecologist, with the obstetrician gynecologist. That's something that, again, we do have treatment options, but before we jump to treatment options, we actually have to find out the reason for infertility. So when women come in to the gynecologist for infertility issues or concerns, we always have to remind them that it's only a portion of the infertility spectrum is actually caused by something due to the female patient. Sometimes it can be due to the male patient.
Right.
So
what do they say? It takes two to tango, right?
Absolutely.
Yeah. I remember that, yes.
Absolutely. So again, it's a matter of seeing or seeking help from the obstetrician gynecologist. And from there, after having a discussion, after having an examination, after undergoing different testing modalities, then we can come up with a reason and also a solution once we know what the issue is.
So we've got the primary care issue. You mentioned breast cancer. I'm sure you're giving the flu shots and the HPV vaccines. You mentioned screening for colorectal cancer. I assume you send patients if they need to be followed up. What are the common complaints that women have that you see in your practice?
Of course. So some of the more common complaints are menstrual irregularities.
Meaning what? I'm not having my period, or I'm having too many periods?
Right.
What does that
So
mean?
again, it's a very broad range of what that means. It essentially encompasses irregular periods, heavy periods, or a combination of irregular and heavy periods, painful periods. So yes, it does encompass quite a significant number of changes in one's period.
Wait, painful periods? I thought all periods are supposed to be painful.
Well, that's true. However, when the patient has to start taking medication for their painful periods, that's something that we refer to as in the medical terminology as dysmenorrhea or painful periods. And that's something that has to be looked into to make sure there are no other underlying issues or problems for the painful periods.
Well, but again, I thought it was normal to have a lot of pain when you have your period. You're saying it's not necessarily normal, and there's a treatment for it?
It is expected to have discomfort during one's menstrual cycle. However, severe pain during menstruation or during one's periods is not something that is considered normal. And yes, there is treatment for that, whether there is pain medication or other things such as hormonal treatment options.
So how would a woman decide whether they should see their gynecologist? What should the yardstick be that my periods are just too painful, I need help, or I want help?
That's the reason why we highly encourage that once a year a woman should see the gynecologist, and those things can be discussed on a one-to-one basis to kind of get an idea of how painful the periods are, or if there has been a change in the menstrual cycle within the past months or years.
So as women get older, you said starting at 15, 16, 17, 18, teenage years, they're seeing their gynecologist every year. Maybe they're doing fine. They develop some complaints, you said prolapse, where things are just coming out that shouldn't be. Painful periods. Are there other things that are common in your practice that you see women having as they get older?
Chronic pelvic pain. Chronic pelvic pain is actually a very unfortunate thing. The reason is there are many reasons. There's at least a few pages of reasons causing pelvic pain or chronic pelvic pain in women.
And when you say chronic pelvic pain, what does that mean?
We typically, in the world of gynecology, pelvic pain that lasts more than 6 months is considered to be chronic.
Every day?
Every day.
Wow, that's a lot of pain.
It is indeed. It is indeed.
I can't believe a woman would even wait 6 months.
Well, unfortunately, some women wait not just months but also years, and they go without pain relief. And one important thing that I would like to underline, as I'm sure that a lot of patients did hear about, is endometriosis. It's one of the main causes of chronic pelvic pain. But as I said, there are other causes such as infections, fibroids, and other causes of pelvic pain. But endometriosis specifically is something that is unfortunately takes years to be diagnosed and goes without being diagnosed on average 6 to 7 years, or sometimes even longer.
Can you explain what is endometriosis?
Sure. So
and why is it so difficult to make the diagnosis?
Absolutely. So endometriosis essentially is material from the lining of the uterus that is found outside the uterus. Essentially, because of the hormonal changes with a menstrual cycle, if you can think of when somebody is having their menstrual cycle, they will actually start bleeding wherever they have those deposits of that specific material from the lining of the uterus.
Wait, so I have my uterus. There's a piece of my uterus that goes somewhere else?
Correct. Piece of the lining of the uterus that is found outside the uterus.
How does it get there?
There are different theories. One of the more common theories is what's called or referred to as retrograde menstruation, meaning that when women have their menstrual cycle, the bleeding that starts within the lining of the uterus and is evacuated vaginally, some of that material goes backwards through the fallopian tubes inside the patient's abdomen.
So it's kind of like a backwash?
Kind of like a backflow.
Wow.
Yes. So that's only one theory. Then we also have genetics and other theories that also can explain men having endometriosis, even though men do not have a uterus.
Okay, that sounds like an entire show in and of itself. Let's just stick with the women. You mentioned genetics. So is this something that runs in families?
Yes. There's a genetic component to endometriosis. And unfortunately, even to this day, there's still, despite the research that is being done, we still don't know the the full effect of the genetic component of endometriosis, but we do know that there is definitely a genetic component.
So if my mother had endometriosis or my grandmother had endometriosis, would I know that?
Well, that's where things get a little more complicated. As I mentioned, endometriosis unfortunately takes years to get diagnosed. The reason is, to come back to your previous question, is the fact that women have vague symptoms that are not really picked up as being endometriosis. For example, painful periods, chronic pelvic pain, painful urination, painful bowel movements, painful intercourse. So again, unless you're being examined or sent to somebody who has been dealing with endometriosis, the diagnosis unfortunately takes years to be made. And just to add on to that, one of the reasons is because at this point in time, the gold standard for endometriosis is a surgical procedure that is called diagnostic laparoscopy, which means essentially that we have to put a camera to look inside the abdomen or the belly of the patient to confirm that the patient does have endometriosis.
So you put a camera in, you look around, you see this abnormal piece of tissue somewhere.
Implants, yeah.
And then you say, patient has endometriosis.
Majority of the, yes, to
That
to
sounds
answer.
simple.
Well, it's not that simple because, at the end of the day, that is a surgical procedure. And not too many patients are willing to undergo that procedure, knowing that, yes, it could be endometriosis, but it might not be endometriosis.
So what else would you tell people who want to be healthy, they want to stay healthy? What are the things that women should do besides seeing you every year to get there? You mentioned the pap smear, you mentioned HPV vaccines, you mentioned breast cancer screening, colorectal cancer screening, the screening techniques, screening things that you talked about. What else would you like all of your patients to know in order to stay healthy?
Sure. So just like everybody else, whether we're dealing with women, men, I think that having a healthy lifestyle, it's very important. Whether that means eating healthy and exercising daily for at least half an hour a day, I think that's something that all women should be aware of and try to achieve that.
And you mentioned osteoporosis. Can you talk a little bit about what that is and how it's treated?
Sure. So again, there are different levels of osteoporosis. When with age, the bones become brittle. Depending on how severe the osteoporosis is, or if we're dealing with the beginnings of osteoporosis, what's before osteoporosis, which is what's referred to as, historically has been referred to as osteopenia. It depends on exactly what we're dealing with as far as the treatment is concerned. Treatment involves anything from calcium and vitamin D supplementation on a daily basis to medications that can improve the bone density.
So I can actually be diagnosed with this issue of brittle bones, if I'm getting it right,
Sure.
and it could be something as simple as a tablet every day.
Yes, it can be as simple as taking your vitamins on a daily basis,
A vitamin.
specifically calcium and vitamin D.
Or it could be a medication, but
Or
it's
it could medication.
completely treatable.
Absolutely.
And if it's not treated, what could happen?
Well, if the patient does not answer or does not respond to the necessary treatment, then we can also help them with different other modalities and different classes of medication.
But if I'm never diagnosed, I never go to a gynecologist.
If you're
or-
never diagnosed
Yeah.
and you do have brittle bones, unfortunately, patients can fall and they can break a hip, they can break a rib, they can break an arm. And that can result in significant morbidity and mortality to the patient.
So again, once again, what we're talking about is taking care of your health by seeing your doctor, whether it's your primary care internist, whether it's your OBGYN, from a primary care standpoint, getting a good sense of your overall health, living a healthy lifestyle, as you say, and being screened appropriately. Thank you so much. It was so helpful to know, and I really appreciate what you do, and thank you for being on the show today.
Thank you. Thanks for having me.
And that brings us to the end of our program today. Thank you for tuning in and learning alongside of us. For more information about our show, please visit us at www.zormed.com and stay updated with South Brooklyn Health by visiting us online. This broadcast was brought to you by Brick Media in partnership with New York City Health and Hospitals, South Brooklyn Health. Until next time, be safe and stay well.